affirming care. Now, part of why I want to discuss this is professional interest, but also because it's very big in the news. It is in state legislators, it's made it at the Supreme Court, which is interesting because it's largely talking about trans folks accessing gender-affirming care. Even though trans folks comprise 1% of the population, a very big percent of the population has opinions on the matter. So I just want to make sure we're all talking about the same thing. So here's some basic vocabulary. When we talk about sex, we're talking about physiological pieces. We're talking about hormones, chromosomes, internal, external anatomy. When we use the term gender, we're talking about how a society describes being a man or a woman. It's a cultural piece. Now, when we come up with a child's gender, we're basing it on the limited information we have. So you see a baby and you're like, it's a boy. And then when that kid is old enough to have a sense of self and they're like, yeah, that's right, we might consider that kid cisgender. If that kid goes, that wasn't enough information, update, we might use the term transgender. So that's what we're talking about. What is gender affirming care? That is any kind of care that affirms our sense of self in terms of gender. So that can be psychological, that can be social, that can be medical interventions. Now, why do we want this? Because we want people to feel gender euphoria. Gender euphoria is when you feel great about who you are and you're more likely to be invested in all your other outcomes. Gender dysphoria sucks balls, and it is when you feel awful and anxious because of the incongruence of your body and how you feel or how you're perceived. And so people get gender affirming care. Now, who's most likely to get gender affirming care? You're right, it's cisgender people. In fact, the minors who are most likely to get gender affirming surgery are teenage boys who are cisgender, who develop gynecomastia. They develop breast tissue that makes them feel very uncomfortable. They get top surgery, fixes the problem. And we don't seem to have an issue with them being able to do that because it has to do with how we've been discussing gender affirming care and what ones we seem to be bothered by. So for instance, anytime somebody gets laser hair removal or gets hair implants, or let's say they treat their erectile dysfunction with drugs or pumps or surgeries because it makes them feel more like a man. That's gender affirming care. Now somebody starts taking steroids because they want to build their muscles. It makes them feel more manly. Gender affirming. Someone gets hormone replacement therapy because they're wanting to combat the impacts of aging or because of the symptoms of menopause. They are affirming their gender. They don't want to lose their feeling of being a woman. And we're generally fine with that. Because again, we want people to be affirmed in their gender. But not only do we just want people to feel good, but if you've never experienced gender dysphoria, great. Because it can be awful, and for many people can lead to incredible levels of desperation and even suicidality. And we don't want anybody to feel that way. But even beyond that, when we feel affirmed in who we are, we're much more likely to take care of ourselves in other ways. We're much more likely to eat well to make sure we sleep, we're less likely to do drugs, and we're more invested in our futures. When people see us the way we want to be seen and speak to us respectfully, we are much more likely to have better wellness outcomes in general. So what are the things that people do if they want to be affirmed? Many of the things are actually just social. It can be hair and clothes and changing your name. But if you want to have feminizing hormones, what's available is like anti-androgens, estrogen, progesterone, and the reason that those were already available for trans women is because cis women take them all the time for a variety of things. Now we are concerned about the side effects of hormones, but if you're concerned about the side effects of hormones for trans women, you should be concerned about the side effects of someone taking birth control for decades at a time. And in fact, we do know that among trans women, they're actually less likely to have cardiac effects from estrogen than cis women are, for a variety of reasons. Now, somebody might also want to have testosterone as a masculinizing hormone. Testosterone goes a really long way, especially for aesthetic changes. There are risks to testosterone, but people take it for a variety of other reasons, like I said, and we do not seem to get as antsy about it. Now, you can take these hormones and then maybe you want to have further things beyond that. There are a variety of top surgeries, bottom surgeries, other cosmetic things that people can have done. Now, where this gets extra sticky is when we're talking about minors. Now, when we're talking about minors, neuroscience shows us that kids who are transgender or gender nonconforming tend to start showing signs of that very, very early. And so they start experiencing gender dysphoria pretty early. So they might go seek help. Now, they're not immediately gonna get anything. What's gonna happen first is they and their parents are going to go to a gender clinic, and for 6 months, literally nothing is gonna happen except maybe social interventions. After that, they may go on puberty blockers. Now, puberty blockers exist because we already were using them on cisgender kids for precocious puberty. So basically what it does is it buys time. Puberty sucks, regardless, even if you want the outcome that is coming from it. So what we do is buy time for kids. They'll be on these puberty suppression, which is reversible for many years, in fact, before they may have access to cross-sex hormones. By the time you would be getting to any cross-sex hormones or getting to any sort of surgery, a child would have been in treatment at that point for a series of years. And again, along with their family, to dispel any notion that this is happening without family intervention. So again, this is only 5 minutes, but the real key question I have for you, the real big takeaway from this question is, when you are making medical decisions for yourself, do you want that to be open to a vote? Do you want that to be a decision made by state legislatures, or do you want that to be a decision that is made by you and your medical professionals? Thank you very much for your time.